Welcome back to my channel.
Many of us are not aware of sickle cell disease. So today let's discuss what you must know about sickle cell disease. What is actually sickle cell disease? Sickle disease refers to a group of genetic disorders in red blood cells that cause hemoglobin, the oxygen-carrying protein, to break down. There are 4 different types of sickle cell disease. First, Hemoglobin Ss Disease. This is the most common type of sickle cell disease. It occurs when you inherit copies of the hemoglobin S gene from both parents. This forms hemoglobin known as HbSS. Second, Hemoglobin Sc Disease. This type of disease happens when one parent gives you the hemoglobin beta S gene and the other gives you the hemoglobin C gene. Third, Hemoglobin Sb plus beta thalassemia. This type of disease affects beta globin gene production. The size of the red blood cell is reduced because less beta protein is made. If inherited with the HbS gene, you will have hemoglobin S beta thalassemia. The 4th kind of sickle cell disease is sickle beta 0 thalassemia. The beta globin B gene is also involved. This type of sickle cell disease displays symptoms that are comparable to HbSS anemia. The symptoms of beta 0 thalassemias can, however, be more severe at times. It has been linked to a worse prognosis. Now let's discuss symptoms of sickle cell disease. Early symptoms can be a vision problem, episode of pain. The intensity and frequency of the pain may change over time. Other symptoms are anemia and fatigue. Sickle cells are more fragile than typical red blood cells, and they usually die within 10 to 20 days. The lifetime of normal cells is 120 days. As a result, anemia, or a deficiency of red blood cells, develops. Now let's move towards the treatment of sickle cell disease. Treatments might include medications and blood transfusions. For some children and teenagers, a stem cell transplant might cure the disease. Hydroxyurea dosage for sickle cell disease has a long history of use as a safe and effective sickle cell disease therapy. The use of hydroxyurea dosage raises total and fetal hemoglobin levels in children with SCD. In a red blood cell transfusion, red blood cells are removed from a supply of donated blood, then given through a vein to a person with sickle cell anemia. This increases the number of normal red blood cells, which helps reduce symptoms and complications. There is no way to know for sure, but there are certain things you can do to improve your chances to get sickle cell disease. Reduce the intake of alcohol. Stop being in contact with sick people. Work with your doctor to manage any other health concerns you may have, such as diabetes. Keep your vaccinations and injections up to date. Lastly, let's discuss sickle cell traits. People who inherit one sickle cell gene and one normal gene have sickle cell trait, SCT. People with SCT usually do not have any of the symptoms of sickle cell disease, but they can pass the trait on to their children. Now let us not take more time and discuss about sickle cell crisis. A sickle cell crisis occurs when sickle-shaped red blood cells clump together and block small blood vessels that carry blood to certain organs, muscles, and bones. This causes mild to severe pain. The pain can last from hours to days. For more information related to sickle cell disease, refer to our website article, which is mentioned below in the description box. Please like, share and subscribe to our channel for more such videos. Thank you for watching.